All right, good morning. It's good to see you. How are we doing this beautiful morning? I hope that you're well. As always, thank you so much for making time for us right here on My Doctor. My name is Winnie Lubembe. Now, today we will talk about something that I don't know how you feel about it, but of course you'll tell us about it as we continue with the show, and that is on labor, because we've had so many stories, some horrific, some, well, just interesting stories about labor. But we would also want to hear your experience as well as far as labor is concerned. How long did you labor for? How was it? Well, you know the drill by now. Please give us a call on 0791478990, or better yet, send us a text message on 40920. Of course, would love to hear from you as far as labor is concerned, because you know what, after months of anticipation, your baby's due date is near. And of course, no one can predict with certainty when labor will begin. So today we want to just focus on all matters labor. If you're pregnant and you're watching us right now and probably you're almost due and wondering what could happen, how will my labor be, how long will I labor for? Well, again, please feel free to send us a text message on 40920, or better yet, give us a call. Our lines are open. 0791478990 is the number to call through now. Our guest is here. He's not new, but just in case you're tuning in today for the very first time, Karibu. And good morning.
Good morning.
It's good to see you. Thank you so much for making time for us on My Doctor. You know, labor, I mean, before we even talk about labor, let's just say hi to the people, introduce yourself, and then we'll come back and talk about all matters labor and the stories that we've had from it.
Yes, good morning, everybody. My name is Matthias Odera Akech. I'm a lecturer at JKU Art
Karibu
School of...
sana. Now, just aspects of labor. I mean, like I said, we've had so many. Personally, I have had so many stories as far as labor is concerned. And I remember we were having this discussion before we came on air. And it's different for different people. There's some people who will tell you, well, me, I labored for like 72 hours. Others will tell you I labored for 4 days. Others will tell you, well, for mine, it was just like 30 minutes or 10 minutes and the baby came out and that was it. So can we just start with the basics? Because I'm really, really curious to find out what brings about the difference. Why is it that there's some people who will labor for long and others it's just a short while and the baby is out? But before that, what exactly is labor, and when, not even when does it come about? Some of the signs that labor is almost due.
Well, thank you for the question. Labor is actually defined as that process that brings about the delivery of the baby. Yeah. Normal labor should start at around 38 weeks to 42 weeks. And if it happens between 6 months, that is 24 weeks, and 37 weeks, then that is abnormal. We call it premature labor.
Okay.
But the normal labor should start at around 38 weeks, between 38 weeks and 42 weeks. And we take 38 weeks from the time one lastly got the menstrual period.
Yeah.
Yes, not when they conceived. Yes.
People sometimes think it's when you conceive and then you start counting. But, I mean, but what about those people who don't know when they last saw their menses?
Well,
Does it become a challenge?
Yeah, it's a challenge, but if they've been attending the antenatal clinics, then we are able to determine how old the pregnancy could possibly be. We check, like, when was the first time the pregnancy test was positive, and we know that it becomes positive around the 6 weeks. And we also use the first time a mom feels the baby moving. And then if they are fortunate enough, then we can also do an ultrasound to determine how old the pregnancy is.
Okay.
So that will give us a rough idea of when to expect labor.
Okay.
Yes.
But now, what about those people who have like irregular periods? I mean, sometimes it just like counts, sometimes it doesn't for like 3 months or so.
Yes, those are the ones that I'm saying that we use when the baby starts to move, because in most cases, for first-time mothers, they start feeling the movement of the baby at around 18 weeks to 20 weeks. So if one is able to tell us when they first started feeling the movements of the baby, then we can extrapolate when the baby will be due. But also if they do an ultrasound early, then we can also tell when the baby will be due.
All right.
Yes.
For the baby's movement, is it and yeah, when you use that to determine when the baby, of course, will be due, is it always almost accurate? Because you see sometimes maybe the baby might start moving and the mother doesn't really like take so much into consideration. It's just like, oh well, oh something is moving and then that's it, and then they forget. So is it almost always accurate, or you give a time like the 2 weeks
Yes,
window?
it's not always accurate,
All right.
but it gives a rough idea. But also, when you are examined by an experienced doctor, they'll be able to tell this size of the uterus corresponds to this number of weeks. So that also gives a rough idea
Oh, yeah.
of when the baby is due.
Okay. Now you talked about an abnormal labor. Can we talk about some of the instances that might bring about that aspect of, let's say, if someone starts to labor, you said at what, around 24 weeks, that is considered abnormal. What are some of the factors that might bring about that aspect of abnormal labor?
Well, some women have problems. Either they have infections that can precipitate an early labor,
All right.
or sometimes they may have a short cervix that may predispose them to getting labor before the due time. Sometimes if they have, like for example, if they break the waters, then labor may start. Or sometimes if the baby dies in the womb, the labor may also start. If they bleed, that can also trigger an early labor. Yes.
So then and especially for the shorter cervix, I mean, is this something that can be picked way earlier? Because you see, sometimes they usually say if you're planning to have a child, you should do like some preparations. I mean, just go for the visits, ensure that everything is in check and all those things. For like something like a shorter cervix, is this something that can be picked earlier? And then let's say the lady is told, and then do a few things to ensure that you do not get labor that is way, way too early.
Yes. A short cervix, we can pick it up if one does an examination
All right.
through the birth canal, and you assess how long is the cervix.
How long should the normal cervix be, though?
More than 2.5 centimeters.
Okay.
Yes.
All right.
So if it is short, or if it is open early in the pregnancy, in the second trimester, then we know it is short. It is a short cervix, and one may get a premature labor. But also, if one does an ultrasound between 14 weeks and 24 weeks, they are able to measure the length of the cervix and determine whether it is cervix that will predispose the woman to having a premature labor or not.
Yeah.
And if we find out that the cervix is short, then we have other things that we do. Either we put a stitch or we put some drugs
Okay.
to prolong the pregnancy to at least up to 36 weeks.
Okay. Now, for the shorter cervix, still on the same, is it more congenital, or are there things that, let's say, happen along the way as a girl grows up that brings about that aspect of shorter cervix?
Yes, both. Some women have a short cervix because they might have had a pregnancy terminated earlier.
Okay.
Or sometimes they may have a short cervix because during a previous delivery, the cervix was torn and it was never realized, so it was not stitched.
Okay.
But also women who get like frequent termination of pregnancies, instrumentation, that predisposes them to a short cervix. But some women also just develop a short cervix for no apparent reason.
Yeah.
And I am seeing that patients who get irregular periods and are diagnosed to have a condition called polycystic ovary syndrome tend to have a short cervix. So the fact that they have irregular periods, we get that when you're taking the history,
Yeah.
then it is a red flag that this lady could be having a short cervix. So before they develop premature labor, we measure the cervix
Okay.
using an ultrasound.
All right.
And if it is short, we advise for intervention.
Oh, yeah. Because you see, the reason why I'm asking that, most of the time you'd find that some women, when they're pregnant, most of them don't even go for their antenatal clinics. So some of these things might be really, really difficult to be picked earlier. But what if one realizes that they have a shorter cervix and they are pregnant already?
Yes.
What happens? Yeah.
If the cervix is short and they're already pregnant, we just need to ascertain that they're having a normal pregnancy. And if the pregnancy is normal, and after reaching 13 weeks, we put a stitch to reinforce the strength
Okay.
of the cervix.
Okay. All right.
Or we put them on certain drugs, pessaries, they insert through the birth canal up to 36 weeks.
All right.
Now that prevents premature deliveries.
Yeah, because we've had a number of cases of premature deliveries from the same, shorter cervix, or it opens way earlier. Okay, so then for the normal labor, can we talk about the stages first before we talk about some of the signs that you're almost getting into labor? Are there different stages for the same?
Yes. Clinically, we divide labor into 4 stages.
Okay.
The first stage of labor is when the cervix starts to dilate. Now, the cervix is normally closed.
All right.
Now, when it starts to open, and it opens up to 10 centimeters, they will say it is fully dilated. That is referred to as the first stage.
Okay.
Now, from the time the cervix is fully opened, that is 10 centimeters, to the time the baby is born, we refer to that as the second stage.
Okay.
Then from the time the baby is born to the time the placenta is born, we refer to that as the third stage. Then the fourth stage is 1 hour after the delivery of the
Okay.
placenta.
Okay.
Yes.
Why is that anyway? Why is that considered as one of the stages? Because see, for most of us, I mean, we just think, oh, well, after the baby is delivered and the placenta, that's it. We're done. But we'll talk about that when we get to that stage. But going through the stages more in depth, for stage 1, what I have here is the latent, active, and transition. So what is happening during these 3 phases, if I would call it that way?
There are 2 phases of the first stage.
Okay.
The first one is this, when the cervix starts to dilate, when it reaches 4 centimeters, we call that as the latent phase. During that time, the contractions are not as strong as in the active phase.
Okay.
And the rate of the cervical opening is also not as fast. It may take 3 to 8 hours. Or sometimes, in some people, it may be several days before they go into active labor.
Yeah.
Now, the active phase is the phase during which the cervix dilates at a rate of about 1 centimeter per hour. And it can take from 2 to 6 hours.
Wow. Okay.
Yes. So in total, the first stage lasts for about 5 to 14 hours.
Okay.
Yes.
And what about the transition then?
There's no transition stage.
Okay.
There are only what happens is that in the second stage, the cervix is fully opened,
Fully opened. Yeah.
but the mother has no urge to bear down. So you find the cervix is open, the head is there, but the mother tells you, I don't have any urge to bear down. We ask them whether they feel an urge to go for a long call, and they say no. But now in the second phase of the second stage, this one now they get the urge to bear down.
Wait, so we're in the second stage now. So and the first part where the cervix is fully dilated, but the mother again does not have the urge to bear down. Is this a problem? Could this
There's no problem.
bring about complications? Because the baby is ready to come out, but the mother does not have.
There's no problem at that particular time, but if there's a problem, we should be able to pick it up.
Okay.
Yes, but it's a normal thing that happens.
Oh, yeah.
We monitor the baby, we monitor the mother.
Okay.
If the heart rate is fine, the mother is fine, then we don't hurry up.
Okay.
Yes.
Let her be. When
Yes.
she's ready, she
Yes.
will.
Yes.
Okay. So then, before we get to the third stage, we talked about the latent phase during stage 1, where this, like you said, this can happen days or hours before the mother, let's say, sometimes goes to a hospital. So I want to know, what is the difference then between this particular phase, the latent phase, and the Braxton Hicks? Because you see, sometimes one might feel that way and think, oh, well, these are just the false labor, and then doesn't do anything.
Well, the one characteristic of labor is that the uterine contractions are regular. They increase in intensity.
Okay.
And also the time interval, the time from one contraction to the
To
other
the other.
contraction
Yeah.
gets shorter as time goes by.
All right. All right.
Then the pain, the discomfort is not pain. The discomfort may also go to the back.
Okay.
Yes. And but one thing is that it is consistent, it increases intensity, and the time interval decreases.
Decreases. All right.
Braxton Hicks will come at irregular intervals and at maybe 1 hour or 20 minutes apart. But for true labor, the time interval decreases and is
Decreases.
persistent,
Yeah.
and there's nothing that makes it go.
Okay.
Yes.
Now, can we talk about then the time? Because again, women are always advised to time so that they know whether this is the actual labor or it's the Braxton Hicks. So, when, not even when, but yeah, after what interval does it begin, especially during the first stage? And then so that by the time they get to deliver, in terms of the intensity, like you said, increases. So like in terms of the time, how does it change, or in terms of the spacing as well?
Well, the time interval decreases, but what I tell my patients is that once you are getting persistent contractions manifested as pain, a pain that comes and goes, comes and goes, let the doctor ascertain that, it was just Braxton Hicks
Okay.
contractions. Because sometimes some women may also have what they may confuse as Braxton Hicks, but they are actually
In labor.
true labor.
Yeah.
So you may find somebody delivering either in the car or at home. So let the health worker examine the cervix, because a true labor, one feature that it has that many clients will not be aware of is that it should cause the cervix to open up. And the health worker is the person who may ascertain whether those pains, those contractions you are getting are causing the uterus, the cervix,
The
sorry,
cervix, yeah.
to open up.
Okay.
Yes.
Okay. Now, pain. So where exactly do they feel it? Because like you said, do you feel it like on the lower abdomen and then it goes all the way to the back, or where exactly? Or you feel the pain everywhere? Because people tell you, I cannot tell you where exactly I'm feeling the pain. I am just not myself. I do not understand where I feel pain, but I am in a lot of pain.
Well, the pain is normally in the lower abdomen.
Yeah.
And when one is getting the discomfort, the lower abdomen also tightens, it hardens. Then it may or it may not go to the back.
Okay. Oh, not everybody
Yes,
gets pain
yes,
in the back.
to
Okay.
the back. But it is felt in the lower abdomen. And if you have that pain going all the way to the back, then there's a bonus for you to know that that pain is not a normal pain.
It's not
Yes.
normal. Okay. And then why does the lower abdomen harden?
What happens is that it is the contraction of the uterus that causes the pain.
Okay. Yeah.
And when the uterus contracts, it hardens and somehow comes out. So if you feel it,
Oh, yeah.
yes. So it is the uterus
Okay.
that is hardening.
All right.
Yes.
Not more so on the.
No.
It's on its own. Okay, and then so let's talk about this pain, because again, like I said earlier on, there's some women who will tell you, well, for me, I felt a little bit of discomfort, And then minutes later, I had my baby. And others will tell you mine was
Horrible.
yes. So yeah, so what brings about the difference in terms of, one, the amount of pain or discomfort, one is in, and then number two, the duration?
Well, we perceive things differently. Even if somebody slaps you, you will feel it differently. So some people, it depends on how prepared they are psychologically and whether they've been informed of what they will feel.
Yeah.
Yes. So that preparation helps them to tolerate pain better.
Really?
Yes, it helps them
Okay.
to tolerate pain better
All right.
than somebody who just gets a surprise that she's having pain.
Yeah.
But also there are people who, they have like a painless labor,
Yeah.
a painless labor.
Yeah.
But that varies from people to from individual to individual.
Yeah.
Yeah. Why some feel an intense pain and others don't varies with the different people.
Different people. Is it more on genetics? So here are the stories that we've had. One, people will tell you when you, during your menses, you had like really painful cramps. When you deliver, it's the opposite. Yeah, when you deliver, like during the labor, you will not, either you will not feel as much pain during labor or it will be really, really painful, and vice versa. If you've never had like painful cramps during your menses, during labor, it will be very, very intense. So is there any truth to it?
Well, that I've not had.
Yeah.
I think it's just people's personal perception, but it's not true that there's a correlation between menstrual pain, and the pain of labor.
Yeah.
No.
But just in terms of quantifying, I know you can't quantify it, but just to put a rough idea, because like you said, if you are prepared psychologically, you're sort of able to tolerate the pain better as compared to someone who was never told about labor, doesn't know anything about it. In terms of the pain, because they say it's like 50 or 100 times more than the cramps that one gets during their menses. So just help us understand.
Yes, by design of God,
Yeah.
they describe it that there is no other pain that you can equate with labor pains. That is their description. But yes, if you look at a woman who is having labor pains, and what they say, some even swear never to
ever
get pregnant again. But after delivery,
they want a child.
Yeah. So,
Yeah.
but they forget. They forget the
Okay.
the
All
pain.
right. So not to scare people, but I mean, it's better for us to know. All right. So we're taking a very short break, but when we come back, we still have stage 3 and 4 to also go through. And then, like he said, and then after the delivery of the baby, the delivery of the placenta, of course, there's also this other last stage, which I'm really curious to find out. So if you're watching us right now, you're pregnant probably, or you just want to understand more about labor, please feel free to call us live 0791 478990 or send us a text message on 40920. All right, welcome back. Glad you're still with us. This is My Doctor, and today our focus is on labor. And like before we went for break, of course, we're discussing about the different stages, the aspects of pain, as far as labor is concerned. And like I said, we're live, so that means you can call in anytime. Our lines are open. 0791 478990 is the number to call through, or send us a text message on 40920, and we'll be looking at them in just a while. But for now, Dr. Okech, can we quickly go through stage 3 and what usually happens during stage 3? Because for stage 1, of course, this is where the cervix is sort of opening, and then for stage 2, delivery. Okay. And then stage 3, then what usually happens during stage 3?
Stage 3 is it occurs after the baby is born. The time interval from the time the baby is born to the time the placenta is born. And actually, for the lady, it's a period of much relief. But for the doctor, it's a period of intense anticipation of problems that may occur.
After.
after the baby is
born.
born,
Yeah.
because that's the time when women who are predisposed to having bleeding, excessive bleeding, do develop excessive bleeding,
Yeah.
and you can't foretell which one is going to have excessive bleeding or not.
Yeah.
So for the doctor, it's a period of anticipation
Yeah.
and getting prepared
Okay.
just in case,
anything
yes,
happens.
happens.
Are there factors that probably might put one more at risk of developing excessive bleeding?
Yeah, patients
After-
who have labored
after-
for long,
Uh-huh.
patients who have multiple pregnancies, patients who had excess water, patients who have infections. Yeah, those are patients who are more
Who are more
predisposed
at risk.
to
Okay.
excessive bleeding.
All right. What do you mean excess water?
There is a normal amount of the water.
Yeah.
The medical term is amniotic fluid.
Fluid, yes.
So if it is excess, whereby it distends the uterus, so that may cause the uterus to expand.
Okay. Okay.
Now, the other thing that may happen is that there could have been tears where during the time the baby was being born, either in the birth canal, in the cervix, or sometimes in the uterus. So for the doctor, this is the time. From the time the baby is born to the time the placenta is born, you are worried about those things happening. Yeah, but for the mother, once the baby is born, the relief is like this.
Yeah. People actually say that once the baby is out, you actually forget that you had
Yeah.
labor. That
The,
is so interesting. Uh-huh.
the person who was laboring and pushing
Yeah.
and ready to give up, go to theater, and the person who is waiting for the placenta to be born are totally different.
Yeah.
Yeah, even the way they talk, the relief, they start giving you stories. Yeah, the pain is completely gone,
Yeah.
and somehow they forget. Yes.
Wow. Okay. So this time relief, like you said, for the mother, but
For the doctor.
quite intense for the doctor. So what are some of the things that might happen aside from excessive bleeding during this after the baby is
born.
Is born. Yes.
One of the things that may happen is actually the complication that may happen, that may be when the head comes out. And usually it's the the shoulders or the rest of the baby should just follow within a minute. But when the head comes out and the baby gets stuck, where the shoulders get stuck in the womb, in the pelvis.
Pelvis, yeah.
So that's a complication that may happen in the second stage. And the other thing that may happen is that the placenta may not separate.
Yeah.
So it gets stuck there.
Okay.
Yes.
What's the likelihood that it may not separate?
It depends on how deep it had invaded the uterus. Yes. So
right.
because in most cases it should separate in less than 30 minutes. But if it remains there, then it means that the doctor has, the health worker has to manually remove the placenta.
Ooh, sounds painful.
Yeah, it should be done in theater.
Yeah. All right. Okay. Okay. And then, so fine. So I don't want to lose this. Fine. So after the baby, let's say, comes out, there are no, let's say, complications that we've talked about during this stage. What are the first things that the doctor has to do, especially for the baby? We're always curious to understand, because they say, oh, the baby has to cry. If the baby doesn't cry, let's say after a particular time, then it could mean this or that. So let's just talk about this particular phase when the baby is out.
Well, after the baby has been born, the first thing that the doctor does or the health worker does is to tie the umbilical cord in two places, then cut
In between.
in between.
Okay.
Then most babies do cry, and if they don't cry, then we just wipe them dry, and if there are secretions in the mouth, in the nose, they are sucked off and stimulate the baby to cry. If it doesn't, then we start giving the baby oxygen with a bag. If the baby doesn't respond, then we put a tube in the air pipe and start to bag the baby. Because one thing that one has to know is that labor itself is hazardous to the
To the
baby.
baby, yeah.
So the baby must be in good form. Yeah, the health of the baby must be perfect for it to withstand the rigors of labor. And also sometimes there are drugs that could have been given that may interfere with the way the baby breathes. So sometimes the baby may be exhausted, may not start to cry immediately.
Yeah.
But as long as the heart is beating and there are no congenital abnormalities, most of those babies do pick up.
Okay.
Yes.
And oh yeah, because we've heard about the baby is held upside down to
Just to allow the secretions to
oh yeah.
Yeah.
Okay. All right. And then just get the baby to cry and then or respond rather.
Yes.
Respond is more okay. So then after the baby is out, you said then of course between what, an hour or so, and then after delivery of the placenta. So do you deliver the placenta almost immediately or allow the mother some time? I mean, because they are exhausted, especially from pushing.
Yes, we allow the placenta, first of all, to separate.
All right.
Okay? And we are able to identify a placenta that has separated and a placenta that has not separated.
Okay.
We look at how long the cord is. Is it getting longer? Is there some blood that comes out, a gush of blood? And how does the uterus feel? Does it feel hard, globular? And does it rise into the abdomen? So
Okay.
once that one has happened, then we know the placenta is separated and we deliver it. We ask the mother to just bear down, but this one is not as painful.
Oh yeah.
Yes.
With not too much energy.
No.
And all those
No.
things.
But we also put traction
All
onto,
right.
the,
Oh, yeah.
onto the cord
Oh,
so
yeah.
that it comes out.
Oh
Yes.
yeah. So like pull it. No.
Pulling it is not the correct word.
All right.
Yes.
Because pulling is more of like force. Like
If you
you're trying
pull it
to-
like that,
Yeah.
one of the things that may happen is
Yeah.
that you may cause the uterus just to evert, and that may cause excessive bleeding.
Yeah. Okay. And we do not want that. Okay. And then allow then the hour that you talked about
Yes,
after delivery of the placenta. Why is this very, very important?
Yes, the fourth stage after the placenta is delivered is very crucial, and this is the time we ask the mother also to participate in her management.
Okay.
And because the bleeding, the bleedings that happen after delivery normally can be noticed before it happens. So we ask the mother to feel her uterus. If it feels like your forehead, that's a uterus that is well contracted and will not relax to allow bleeding.
Okay.
If it feels like the tip of your nose, then it means there's a problem. It will relax and will allow the bleeding to occur. So, but by massaging, by just rubbing on the uterus, one stimulates the uterus to contract,
Okay.
thereby preventing the excessive bleeding.
Okay.
So it is important because it is that hour when these things, this bleeding, which is the number one killer of women who are giving birth, to occur.
Okay.
It occurs within the first hour. That's why we say that during that time, in fact, it's advisable that the mother is not left alone, that somebody be with her. But if, for example, in many places, in many public hospitals, having a nurse to stay with you is a luxury that the hospital may not afford. So we ask the mother just to feel herself, and if she has somebody, also to monitor the beddings, if she's soiling the beddings with blood.
Yeah.
So that hour after delivery is important that she does those things.
Okay. Now, because I wanted to ask, I mean, immediately after delivery of the baby and the placenta, does then the uterus contract almost immediately? And how are you able to feel it? Because they say, I mean, the uterus is what, the size of an apple, like it's that small. So does it contract like immediately, or is it slowly I mean, it slowly gets back to its original form.
Yes, after the delivery of the placenta, it contracts and becomes hard,
Okay.
becomes as hard as your forehead. And you can feel it almost at the level of the navel.
Okay.
But for it to go back to its normal size, which is almost the size of your fist, it takes time. But if it is contracted, then that is normal. But yes.
Okay, all right. Because okay, so then immediately after the delivery, and I don't know if you've had this, where women are all. Okay, this is a story that people say, so I don't know if it's like medically advisable or this is again just stories that people say off or based on their experience, where women are told to ensure that they tie around the stomach so that it doesn't remain big or doesn't become big. So is it true, or what usually happens? I mean, for the same, because of course people are curious, like what happens to now the stomach after the baby is out in the placenta?
Well, I've seen it. I've seen women tie their tummy after delivery, but it has no effect
Okay.
in terms of the uterus going back to its normal size.
Yeah.
It will go automatically to its normal size, whether you tie or you don't tie.
Okay.
But because it is not harmful,
Yeah.
and somebody feels nice to tie, then we say, oh, it's all right.
Okay.
Yes.
Just go ahead and
Yes.
do it.
It's not harmful. Though.
Okay.
Yes.
All right. But why do you think women do that though?
I think it's just psychological aspect, whereby you want your tummy to go back
the way
it was before.
Yes.
But it will eventually go back to the way it was before, even if you don't tie.
Yeah.
Yes.
But I mean, this is different for different women. For some, it will almost go back to its original form almost immediately. But for some others, it will take quite some time.
It won't go back immediately.
Oh, yeah?
It will take time.
Take time.
It will
Oh
take
wait,
time.
so what usually happens? I mean, for those who we see like 3 days later and they have like a very flat tummy, and we're like, okay, wait, what happened? Is this more on surgeries like liposuction, or what usually happens?
Well, the distension on the abdomen will still be there. Maybe you are just seeing the outside, but the inside, even the distension that was there in the abdomen, will still be there.
Yeah.
Yes.
Okay. Will take time. All right. Okay. Now, before even the delivery and all the stages that we've talked about, we have had about other women being induced and other women being, given epidural and all those things. So can you just take us through what this two means? And is there a provision, let's say, especially in the country, especially for epidural?
Yes. First, for induction. Labor is induced. We say that we are going to induce labor because we are going to start the process of labor ourselves, not spontaneously on its own.
Okay.
And there are certain times where one is advised to have labor induced. For example, if the pregnancy has lasted for more than 42 weeks, then it is better that the labor is induced. Or if the mother has a problem, for example, if the mother has high blood pressure that is uncontrollable, it may affect her or affect the baby.
Yeah.
So we may need to induce the labor. And sometimes if there is early breaking of the waters, then we may also need to induce labor. If there's infection, we may also need to induce labor. But also, if the baby, her or himself, has a problem, for example, the baby is not growing the way it should grow, then we may also need to induce labor. Because sometimes we say that it's better outside than inside.
Yeah.
And now that's a decision that has to be made by the health worker together with the mother herself and her family, that because of this and that, we feel it is better for the baby to be born than for the baby to continue staying inside.
Yeah.
Now, the other question that you asked was
in terms of the epidural, the pain.
epidural,
Yes.
yeah, the pain. Yes, the epidural is available, but I don't think it's available in most public facilities.
All right. Okay.
Yeah, but in most private facilities, especially in Nairobi, it's available. It relieves pain. Some women have a painless labor.
Yeah.
Yes.
From the same. So you can actually request.
Yes, you can request.
Okay.
But it's just better that you request early that I would want an epidural, so that arrangements are made to avail because it's normally done by the anesthetists.
Oh.
Yes.
Okay.
It's done
All
by the
right.
anesthetist.
Okay.
So avail the anesthetist and all that that is needed for the
All right.
epidural.
Wait, what usually happens? It's just not something that's injected and then you're good to go. And how early do you inject? Does a person who has requested for an epidural get it? I mean, do you have to get it before you start labor, or is it during, when, let's say, the pain is not as intense as compared to, yeah?
Yes, it has to, it should be given after the onset of labor.
Of labor,
And
okay.
it's advisable that it is given when the contractions are getting more intense. That is
Alright.
in the active phase of the first stage.
Yeah.
Yeah, so it should be given after the onset of labor. Now, what happens is that they give some local anesthetics
Alright.
onto your back
Okay.
to make it numb. Then they thread a needle
All right.
and they give you it's a local anesthetic.
All right.
So that makes the legs numb.
Okay.
Yes.
So you won't feel
You won't feel
as
that
much
as badly.
as much pain.
Yes.
As okay. All right. And then, so are there some people who are sort of excluded from getting an epidural?
Yes.
Okay.
For example, because some of the effects of epidural is that if they put a needle, you may be having a blood clotting problem, so you'll be excluded. And the other thing is that that medicine makes the blood pressure to drop.
Okay.
So if one has a heart problem, then you may be excluded from getting
an epidural.
an epidural.
Yeah.
Yes.
Oh wow. Okay, so so you have to just deal with the pain, and you'll be good.
We may give other things to
All right,
relieve the
all right,
pain. Yes.
Okay. Okay. Not
Yes.
just the normal painkillers.
Even paracetamol helps.
They do.
Yes, they help.
Oh wow. Okay. All right. Now, so after delivery, all those things, and the baby is safe, the mother is safe. Can we talk about then after delivery, some of the things, and especially if it's like a natural birth, what are some of the things that the mother is supposed to do, especially for the first few weeks? And what are some of the things, especially for the first-time moms, what are some of the changes that they will experience so that, someone knows?
Well, after delivery, we normally instruct or advise the mother to be on the lookout for a few things
All right.
on herself and so on the
On
baby.
the baby, okay.
To the baby, the baby must pass poop. So if the baby doesn't pass poop in 24 hours, you let us know. The baby must be able to breastfeed. If the baby is not breastfeeding, you let us know. The baby may convulse, a fit. If the baby fits, you have to let us know.
Okay.
If the baby develops fever, and the digital moms of today, there's a digital thermometer. You just put it and you read. If it is high, you have to let us know. A baby who is just crying uncontrollably, baby is not wet, the baby has fed, the baby is not hot, but the baby is crying. You have to let us know.
Okay.
Now, for the mother, you also have to be on the lookout for a few things.
Okay.
One, the bleeding that follow delivery, is it excess or not? And this one should be able to tell whether it is excess depending on how many pads are you using per day,
All right.
is it decreasing or is it the same or is it getting worse?
All right.
Then you also need to let us know whether you're feeling a continuous pain in the lower abdomen, okay? Or the discharge that comes out, does it have a foul smell? Then you have to let us know. Then for first-time mothers, I normally say that there are a few things that you have to know about the baby. One has to know how to bathe the baby.
Yeah.
Have to bathe the baby. You have to know how to latch the baby onto the breasts. You have to know how to remove the baby from the breasts
Okay.
after feeding. Then you also have to know how to wrap the baby now that it is cold.
Yeah.
Yes, you must know how to wrap the baby. But all these lessons are given
During the visits.
after delivery.
Okay.
Yes, we would have a practical lesson on how
Okay.
these ones are done.
Okay.
Yes.
All right. So a few questions. For the baby, you said the baby should poop in a span of 24 hours. So is the color a factor?
Most cases, the poop is greenish
Okay.
in color. But as time goes by, it becomes the usual yellow kind of color.
Okay. And then the baby crying uncontrollably, and I mean, factors that we've talked about that might lead the baby to crying, everything checks out, it's not happening. What could that mean?
One of the things is that the baby may be having an infection, but you're not picking it up.
Yeah.
Yeah. Sometimes some babies do develop complications, like they may have a bleed even in the brain. So the clinician has to examine and find out why is this baby crying, because a baby should be calm. Yes.
Yeah. Okay. And then an aspect of colic, I don't know if we did that topic or we are yet to do or to talk about, colic and all those things. And then for the mother, how long should normally is the bleeding supposed to go on for?
The first few hours, the bleeding tends to be a bit heavy.
Okay.
But as time goes by, it decreases. But any bleeding that goes up to 6 weeks is normal. But beyond that, it is abnormal.
All right.
But sometimes the bleeding may be excessive on the 4th day. Okay?
Okay.
More than what it was before.
On the first
Yes,
day.
if it is increasing.
Okay.
That could also be a sign that a mother is having an infection. So if the bleeding is not decreasing, if it decreased and increased again, or if it persistently remains heavy, then it could mean that there's a problem. So we need to check either a tissue remained inside the womb, or there's an infection that is causing the bleeding.
Okay. And then for the foul smell, is it more on the infection or it could mean something else?
It means infection.
Infection. Okay. And then for those who sometimes have to be stitched, what is the management for the same to ensure that they heal properly? And after how long are they supposed to be fully healed?
Well, it depends on individual.
Okay.
But the healing process depends on how well it was stitched. I've seen some patients stitched in a way that it will take time to heal. So, but if stitched well, whereby all the tissues are put together and the knots are buried inside, 6 weeks they should heal.
Oh, okay.
But if it's not stitched well, either the tissues are overlapping or the knots are outside, or one doesn't use the correct stitch, and sometimes one has nothing, especially in the other facilities when you have nothing, but you have to stitch anyway.
Yeah.
So you will just stitch. But so it depends on how well it is stitched, whether you're using the appropriate stitch. Yes, then we advise that after stitching, before people used to be asked to sit on salty water, which I think is a bit uncomfortable.
Yeah.
And studies have shown that
Yeah.
it doesn't improve the healing.
Oh, really?
Yes.
Okay.
So what we advise mothers is that just clean it, make the area down there to be as clean as your face,
Possible. Yeah.
and keep it dry most of the time.
Okay.
Yes.
Okay, dry, and because I'm thinking, okay, keep it dry, but there's an aspect of bleeding. Hey, but try.
What I mean is that
Yeah.
after visiting the toilet, and especially after a long call,
Yeah.
it's better to wash and pad it dry.
Oh, yeah.
That's what I mean.
Okay.
Yes.
All right. Okay. So we have like a minute to go. So in terms of then just labor in general, and I think I will take this as your pattern shot, but also wanted us to talk a little bit about stillbirth. And after that, like, what are some of the things that, let's say, the mother should do to ensure that, I mean, they heal properly, the uterus also, heals or goes back to its original form, and then before trying. Can you talk about this in like a minute?
Well, for stillbirth, it's a long story.
Yeah.
It's a big topic.
It's a big topic on
yes.
its own, yeah.
But what we advise women to do is that after 24 weeks, monitor how the baby is moving. Because a baby who is having a problem will not just die.
Yeah.
Just like us, when we eventually exit this stage, unless something happens, it just doesn't happen.
Yeah.
So the first thing that happens is that the baby will stop moving. So when you realize that the baby is not moving the way the baby has been moving before,
yeah.
then it's better go to hospital to be checked.
Yeah.
Yes, and because sometimes we are able to pick up that this baby is so unwell that we need to deliver the baby early, even before the due date. And most of them do survive.
Yeah.
Yes.
So just ensure that
you monitor how the baby is moving.
Yeah. Yeah.
If the baby has not moved in a span of 12 hours, it's good to check with your health worker whether the baby is fine or not. Yes,
Okay.
when you go, they will be able to do some tests to find out about the well-being of the baby. Yes.
All right, and in the interest of time, we have to end the show right now, but I think we'll just need to discuss about stillbirth on its own. So thank you so much, Dr. Okech, for coming by today. I have learned a lot from today's episode, and I believe that you've also learned a lot as far as labor and delivery is concerned. But if you still have any questions, just send them on our SMS line, and then we'll be able to forward it to Dr. Okech, who'll be able to answer all your questions. But that is where we wrap up My Doctor today. I believe that, again, you've learned a lot from today's episode. If you missed the first part, don't worry, you can still catch the repeat later on tonight at 11 p.m. or catch the full episode on our YouTube page, and that is on Ebru TV. My name is Winnie Lubembe. God bless. Stay safe. See you next week on Monday, same time, same place. Goodbye.